Justine, one would expect that today doctors and nurses are on duty, but here at the Kamwesi Mall in Chevando is where I've found Dr. Herbert Luswata. He is Secretary General for the Uganda Medical Association. These are doctors, these are medical professions. One would expect that these are put lives first, they save lives, but now they are on strike. From midnight, they have been on strike. I don't know for how long, but they are supposed to be treating and saving lives. Here, Dr. Luswata, good morning to you.
Yes, good morning.
I would expect you to be in a hospital saving a life. I found you here in the restaurant.
Exactly, I should be in the hospital, but today since we're on the strike and we are not working, I decided to come here and have my breakfast at Sweetie Defined Restaurant.
Why are you choosing to neglect the lives of these waiting people? They're aiding and waiting in the hospitals because for you are seeking, maybe one would say, selfish interests.
They are not selfish interests, and I would like to put one thing clear, is that anyone who has an emergency, all emergencies are being handled in the hospital, and we do not have any intention of seeing any Ugandan dying because we are on this strike. There are some doctors who are reserved on ground in the hospitals and providing all emergency services. So if there's any mother who is in labor and she needs to deliver, anyone who has gotten an accident, please go to hospital. The doctors are there to handle emergencies and they will work on you.
Yes, I understand the medical fees, the bare minimum, the one who is taking less is taking 2.5. And based on the way of the conditions of many Ugandans, some even survive. Yes, I know you went to school, you studied, so you invested in a lot, but even many are even surviving on less than 500,000. But for you, taking 2.5 and looking at the economy, how it's dealing now, you would expect that maybe this is fair enough, considering the economy and how it stands.
The economy is good, and Uganda has money to pay doctors better. Actually, in East Africa, Uganda is the country which is paying the least. We are the ones who are poorly paid. But in all other countries, doctors are paid very well. And yes, I want to affirm that this government has money and they can pay doctors very well. By the time a president of a country comes out and gives a directive that the salaries of doctors must be increased and even mentions the amount, he's cognizant and is aware that the government can afford. So the government knows that the medical officer is earning around 2.4 take home. He's aware that an intern is earning 750,000 shillings, and he's also aware that that money is too little.
So how much do you want as medical interns, as doctors?
We negotiated with government first in 2017, and the president gave a directive and said that the starting doctor should earn at least 5 million take home. That was in 2017. On 1st June this year, we went back to remind the president, because it has been 4 years. We went back to remind him that, Mr. President, you gave a directive 4 years ago, and it has not been effected. Things have changed. Things are very expensive. We need more money. Doctors are not ordinary people. Our needs are high. They are very expensive. A doctor should have a car. A doctor should live a life of a doctor. So that the money you're talking about is very little. We cannot afford to live as doctors with such money.
So how many doctors are we even talking about, and what are other demands that, away from the salaries, that you would want to see are in place so that you have a better, conducive environment? The
presidential directive mentioned that we should have 5 million medical officers, that is take home. The interns 2.5 million take home. The doctors currently we have in Uganda are 7,000 who are represented by Uganda Medical Association. They are all members. And some of them are within government hospitals, others are employed in private hospitals, others are unemployed. However, the other issue, our plea to government, and it was also in the presidential directive, to ensure that the more than 60% of the positions in government, which are supposed to be filled by doctors, are filled through recruitment, through public service. That is another thing we need to do. Whenever you have the doctors are very few in the hospitals, at the end of the day, it is the Ugandans who suffer because they are the ones who come to these hospitals.
You say you are dealing with the health sector, which is also sick in its way. You've seen many health facilities in dire situation. talk about Arua, talk about Eastern Uganda. Many of these health centers are also in the need maybe to immediate attention. Even before one would think about raising the salaries, would think about maybe putting these facilities in better shape.
You know, it has been a long time, and we should also remember that our government has been in power for over 30 years, and they have been having work plans for years and years. We also have, I don't know how I can call them, the World Health Organization recommends that the health budget of any country should be at least 15%. It has been on for a very long time. We have been having conferences here for Millennium Development Goals now, which have even changed, and these things have been talked about over and over again. But the budget of Uganda for health has never reached that level. Actually, the biggest funding to our health sector in Uganda is mainly by donors. But the people who are getting the services in the health sector are Ugandans, and they are paying taxes. So one would wonder, if Ugandans are paying their taxes and they cannot benefit from their taxes through getting good health care, then what is the government using this money? Why can't we have the 15% of the budget going into health? If this budget of 15% was there, by now Uganda would be having very good hospitals. Each and every regional referral would be having an ICU. We would not need to have people moving from Uguru, moving from Mbare, moving from Nakapiripiriti, all flooding Mulago looking for ICU, which also has actually a very small capacity. They end up being bounced and sent to private hospitals. They pay a lot of bills. And it is really worse.
Dr. Ruswata,
yes.
You being the Secretary General of Uganda Medical Association, this is a new administration that you're coming to. Just the other day, you just appointed or even elected. But this is a cry that has been on for the last 4 years. You're crying for medical salary increment and other facilities.
Yes.
But this seems to be a war that you are not winning. What are you going to do differently that maybe you can government can take you serious?
Yes, actually, you put it very right. It seems like a war we are not winning because 4 years is a long time. You know, we gave government a 90 days notice. When the president gave a directive that actually the 5 million take-home should start by July this year. Today we are in November. That money never came. And we have been wondering why would the president give a directive in 2017 and again in 2021, and these things are not fulfilled. Who is that is above the president can stop such things from happening? And for us, we are saying that as long as we have the will of the president, the fountain of honor, this money must come. They should listen to the presidential directive. We need the money to come. We need to have enough drugs in the hospitals for our patients. We are tired of writing drugs and telling people to buy them.
So what is the Minister of Health, Minister of Public Service, Minister of Finance, what are these ministries telling you
now,
that is failing them to put into place?
I think about 3 weeks ago, Minister of Public Service actually came out and informed us that yes, they saw the presidential directive, however, they will not implement it as directed by the president, that they will not give us a salary increment starting by July this year. And for them, they were saying that they implement the presidential directive in the financial year of 2022-2023, that is next year. And when we took back this information to the doctors, they said no. This is now becoming like an abuse. We got the same promises in 2017, nothing happened. We are getting another presidential directive 2021, again you are pushing us forward. And that's why we decided that no, maybe this time around, we should go for industrial action. And maybe in this way we shall have this government implement their promises.
Are you willing to push this industrial action? And what's the impact so far between midnight and now? Are you even receiving anything that maybe across the country, this seems to be the impact? The doctors on work?
The information we are getting actually is that doctors have stayed home. Because we had a brief meeting.
Across the country?
We had a brief meeting this morning, mainly regional referral hospitals and the national referral hospitals, mainly here in Kampala, because those are the big guns. And the reports we are getting that they are not on duty. And actually, the industrial action, it is also good in one way or the other, because the public will cry out to the president. Because they are not receiving services, they are mandated to receive from the government. Why? And if they understand the issue is that the government is not paying the doctors very well, probably they will add on our voice. And maybe when the electorate who elect these leaders into power bring their voice, the government will be able to understand. Because probably us as doctors, because mainly a doctor, we are supposed to sit on table and discuss with someone. You're not supposed to be striking. We are not supposed to be at this level of striking. A doctor is striking, but the government has reduced us to that level. So we have no other choice. We need the masses, the public, to come and support us, add their voice, to have the government adhere to its promises, so that we can have better services.
I know you were also hit as doctors during the COVID-19 pandemic, both on duty and from home, wherever you stay. But now, if the president comes to your attention, he knows that you are dealing with a very difficult situation of fighting COVID-19, where many of you even lost lives, where others were affected in a different way. But if he's to get your attention, now that you are on strike, what would you want to tell him if you have an interface with him as we wind up finally?
Yes, if you have an interface with the president right now, it is very simple. What we want to tell him is to remind him of what he has promised us. Number one, the salary increment, like he promised. Number two, the compensation for the doctors who died during the battle of COVID-19. The Workmen's Compensation Act is very clear on this, that when someone dies on duty, their families are supposed to receive money to help them to move on in the absence of this person. And the law is very clear. You get the salary the person has been getting at the time of death, multiply it by 60, and this money is supposed to be given to their families. We had the bombs recently, and the families of the victims of the bombs are going to be given money by government. But the doctors for 2 years now have not seen that money.
Hopefully they receive that money. Thank you so much, Dr. Herbert Ruswata. He is the Secretary General for Uganda Medical Association, and he is telling me that from midnight across the country, that doctors are not on duty, they are on a strike, and that's industrial action. I hope you are able to receive medical attention when you move into a hospital or a health facility, wherever you head to, because the doctors have begun their strike. Stephen Imbido and Fefe Chibuga coming to you from Chebando, and now have to hand you back to Justin, who is there in the studio for concluding remarks of the show. Keep it here on NTV.